What is the gold standard treatment for onychomycosis? Oral antifungal therapy, like in the form of pills, particularly terbinafine or Itraconazole, is considered the gold standard for onychomycosis, both in children and adults, because of shorter courses of treatment and higher cure rates. When compared with topical antifungal therapy, like creams, lotions, drops. Why oral antifungals are better than topical antifungal? Studies have shown that oral antifungals, particularly terbinafine, have higher cure rates than topical treatments. Oral antifungals are absorbed into the bloodstream and then deposited into the nail bed, where they can effectively target and kill the fungus. Topical treatments often have difficulty penetrating the thick, hard nail plate, limiting their effectiveness. Elaboration. The most effective treatment for onychomycosis is typically oral antifungal medications, particularly terbinafine or Itraconazole. These drugs help the new nail grow free of infection, slowly replacing the infected part. They work by inhibiting the growth of the fungus, allowing the body to grow a new, healthy nail. Oral antifungal therapy generally leads to higher cure rates and shorter treatment periods compared to topical treatments. Topical treatments, while available, are often less effective than oral medications. Can onychomycosis go away without treatment? No, onychomycosis does not typically go away on its own, without treatment. The infection can worsen if left untreated, potentially spreading to other nails, or even to the skin. Without treatment, the infection can advance, leading to thicker, discolored nails, and potentially, separation of the nail from the nail bed. In severe cases, untreated fungal nail infections can spread to the surrounding skin, or even lead to bacterial infections. What happens if onychomycosis is left untreated? Untreated nail fungus can lead to a variety of problems. In individuals with weakened immune systems, or diabetes, untreated nail fungus can increase the risk of bacterial infections of the surrounding skin. Nail changes. Untreated nail fungus can cause the nail to become thick, brittle, discolored, and distorted. The nail may also become crumbly, or even separate from the nail bed. Spread of infection. The fungus can spread to other nails, making it difficult to treat and potentially leading to a more widespread infection. Secondary infections. In individuals with weakened immune systems, diabetes, or other conditions, nail fungus can increase the risk of bacterial infections of the surrounding skin. Pain and discomfort. As the infection progresses, the nail can become painful and make it difficult to wear shoes or perform everyday tasks. Potential for amputation. In severe cases, particularly in individuals with diabetes or other conditions, nail fungus can lead to serious complications, including cellulitis, osteomyelitis, tissue damage, and potentially even amputation. That wraps up our discussion on nail fungus. We should always remember important considerations. Fungal nail infections can be contagious and can spread from person to person or through contact with contaminated surfaces. Early diagnosis and treatment are crucial to prevent the progression of the infection and minimize complications. Maintaining good foot hygiene and keeping feet dry can help prevent the spread of fungal infections.